Hi, I'm Dr. Riemenschneider. I'm going to share some information with you that we want our patients to know. This is new information. It's a new insight as to how we may be able to deal with prostate cancer and make it curable when before this, it surely to this time has not been. We're going to talk about a new subject. There are controversial areas that relate to it, and it's a complex concept, but we're going to give you a very brief synopsis here on the web. What we want to do is harness this immune system to allow us to treat prostate cancer. Not just prostate cancer within the prostate, but possibly prostate cancer that has spread beyond the prostate. This information was presented at the Prostate Cancer Research Institute meeting in California in September of this year. Immunotherapy, the body's own defense system. How does it work? Well, that's a complicated question, and I can assure you we're not going to answer that in just a few moments. But let me give you an overview. You've probably all heard of T-cells. Well, T-cells are part of our lymphatic system, and they can be the major soldiers of our defenses. And what happens is that these T-cells go from very passive cells under some circumstances to very aggressive cells, and can be known as killer T-cells or terminators. Now, cancer cells, along with all other cells, display individuality through the presentation of antigens that are attached to whatever cell or cell type we're talking about. And there is a cell in our lymphatic system known as the dendritic cell that is sort of the detective. And it circulates in our body and it goes out and checks to see how things are. And when it finds an antigen that doesn't belong there, it gets pretty focused on that. It doesn't do anything to it directly, but what it does do is it goes back to the lymph tissue. It gives a call to the T-cells and says, hey boys, wake up, we've got work to do. And what happens then, it disseminates the antigen which it has captured from these cells and provides that to the T-cells, and then they become the terminators and they go to work. If we're talking about tumor cells and we're talking about a reasonably small volume of tumor cells, if we get the T-cells turned on at the right time, there's a good chance that these T-cells can kill this tumor wherever it is in our body, whether it's in the prostate or beyond. It seems when we have a tumor, particularly sizable tumor, or maybe just a small tumor, it has the potential to activate regulatory T-cells. And what that does is it turns down the immune response. So what we want to do is figure out how to turn down the regulatory T-cells, at least for a short period of time. And there appears to be more than one way to do this. But for the moment, I'm just going to mention one, and that is an old drug called Cytoxan. Well, there's reason to believe that if cells that make up prostate tumor are destroyed by cryoablation, a lot of the antigens that are related to these prostate cancer cells are released. The dendritic cell, or the detective, picks up the information, races back to the lymphatic system, and turns on the T-cells to become the terminators. They go out and start their work, cold and heat. And if you look at the survival statistics in this research group, that's the highest, what you find is that cryosurgery with Cytoxan gives us the best outcome. So the highest survival for the longest period of time is with cryosurgery and Cytoxan. This is an overview of the clinical trial that has recently been approved by the FDA and is known as VDC 2008. Cryoablation is performed. The dendritic cells are injected into the tumor site right after the cryoablation. The dendritic cells pick up the antigens on the tumor cells of the prostate cancer. They're taken back to the lymph node, and activated killer cells are sent out to the bloodstream. Now this has a fairly broad application. For instance, if somebody has metastatic disease, there's reason to believe that this immune response will alter that metastatic disease and hopefully eliminate it. So this is an overview of the study group. As you can see, a fair number of the patients didn't do well, but some did. Here's one that seemed to have a very good response with no evidence of disease up to a year. And 4 patients had PSA drop, and for a few months there was no disease progression. So this was enough information then to allow this study to be presented to the FDA. Let's look at this case just so we understand it. Here was a large tumor, and after the patient was treated, although there was still tumor present, there was significantly less, as monitored by color Doppler. Immunotherapy has a promising place in investigation. It has the potential to be used with patients with metastatic disease, and it may also be useful in patients who have large primary tumors. It can be used for then both local or systemic disease control. The FDA has approved this study. Basically, we're trying to understand what happens to lymph nodes that we can identify when this treatment is used. And we're also looking at the PSA response, and we'd like to see the metastatic disease diminish. This study is currently recruiting candidates. If you're interested, I suggest you call Riverside Urology at 614-442-3000. Dr. Bond is the coordinator of this study. He's in Ventura, California. And once again, if you think you're a candidate, contact our office. We'll help you understand what option is available to you with this clinical trial.